Hello, John. Can you hear me? This is Julian.
Hi,
Not
everybody.
sure.
It's Agnes here. I can hear you, Julian.
Okay, good. I just saw John Minto on the video for a second there, but he didn't hear me, I don't think. Hi, Quick. Are you with us?
Hi, Julian. Yes, yeah, we're all on.
Great. Good morning.
Get going.
Yes, hello.
Do you know if we're recording? I don't see Fanny online.
Fami is online. I've been chatting to him through the chat function, which is probably the best way if he's not hearing us at the moment.
He's the MERWHOHQ offender, if that helps.
Okay, and Dixon is on. That's good.
Hi, Dixon.
All right. So I think it's 12 o'clock. So in the interest of time, or 12 o'clock Central African time, I should say. So in the interest of time, let's get going. So first of all, welcome everybody to the first MHIN Africa live launch webinar. Very historic occasion, and a big thank you to and to the team from MHIN Global in London, and to Margie Schneider for all their work in preparing for this webinar. My name is Crick Lund. I'm based here at the University of Cape Town at the Alan J. Flisher Center for Public Mental Health. And we have a very interesting lineup for the webinar today. We'll start with Dr. Julian Eaton, who will give a background and an overview of the Mental Health Innovation Network globally. And then I will do a brief presentation on MHIN Africa and its development. And then our main guest speaker for today will be Dr. Dixon Chibanda, who is a psychiatrist from Zimbabwe, and will be presenting some of his work on the friendship bench and other areas. And then the second guest speaker is Dr. Florence Bayangana, who is a Ugandan psychiatrist, but will be speaking about her work in Sierra Leone and other areas that she's involved in. And then we'll conclude with some opportunity for some general interaction and questions from all of you out there who are interested in this area. So without further ado, let me welcome Dr. Julian Eaton and hand over to you, Julian, to give us a background on MHIN.
Good morning, everyone. It's good morning for me, certainly. I'm sitting in the London MHIN office at the London School of Hygiene and Tropical Medicine. MHIN is a collaboration between London School of Hygiene and Tropical Medicine and the World Health Organization, and has been largely funded to date through Grand Challenges Canada, as well as some specific projects that have been done with other collaborators. So, first of all, what is MHIN? Well, I'm talking now about the original MHIN, so the MHIN that had a global perspective before we move on to thinking about MHIN Africa. We're a network of people who have an interest in mental health and a center for collating and sharing knowledge and information about how we can really improve the quality and coverage of care for people who have mental health problems around the world. By stakeholders, we mean people who have either use services or involved in research related to services, or in some way coordinate and organize services. So the mission of MHIN is to really build on the really exciting change we've seen over the last maybe 15, 20 years in interest in global mental health compared to the way it was really neglected previous to that. To look at what works, to think about how those people who are working in the field with exciting new innovations can be supported to make those innovations maybe work better, but also how they can communicate their achievements and to look at how they can scale those achievements up to a larger population so that more people can benefit from them. the ways that we are doing that and have been doing that is largely about information. It's about understanding what people need, understanding what their achievements have been, how their innovations work, and learning from that, and then packaging those pieces of information in a convenient way for other people to learn from and build on themselves. Then the network function is really important. So looking at where historically people doing those interesting pieces of work haven't really been able to communicate with each other, not really been able to learn from each other. And the function of the MHIN website enables people to be able to get together and communicate, much as we are now. We're looking forward to hearing from you at the end of these brief presentations. And then there's a role, I think, to build on that idea of a growing global commitment towards mental health care being more accessible, to actually look at what the common messages that we want to share with the outside world are from all of these innovators, from the stakeholders who are engaged in this work. And so we've developed a range of really exciting resources that help to communicate those messages in a powerful and effective way to policymakers, for example. And the purpose of all of that is really to do two main things: to reduce the treatment gap, which has been a really big focus of global mental health, really for the last 10 years or so, and to promote good health, good mental health. And then there's a really important component, which is to think about the quality of life that people have in relation to their human rights being achieved. So the objectives that we have is largely around this idea of knowledge synthesis, of bringing together the people who are doing the innovative work in the field and people who are really focused on research in relation to accessible mental health care, and then finding a way of really effectively communicating that to the people who need to hear that information and whose practice might be positively affected by having access to that communication. So who are the people involved in this work? Well, first of all, very importantly, it's the people who are generating this knowledge, the people who are doing the work, the people who are doing the research. And then ultimately, we want to affect change in the world. We want people who make decisions, partly about money, about resources, about priorities of their governments or their organizations, to make the right decisions, to raise the profile of mental health work in the global health agenda. And there are a group of people in between that, who we've called enablers and supporters, that people who manage information, people who coordinate bodies, for example, like the WHO, or people who manage media, for example, who are important go-betweens in that process of knowledge exchange and decision-making. So there's a couple of examples of some of the innovations. First of all, the Friendship Bench, which you're going to hear about in a minute, so I won't talk about that anymore, and another example of important WHO guidelines and tool called MHGAP being used in Lagos in integration into primary care. And in the process of those types of innovations being used, we moved from people developing these ideas, learning from each other in doing so, networking in doing so, to becoming progressively more effective in changing the way that the resources are available to do this work at a much larger scale, and engaging in this really important group of service users who have historically been quite neglected in this type of work, but whose position we've really sought to highlight in MHIN. I mentioned earlier some of the resources that have been developed specifically by MHIN to make this type of work more effectively, and there's some examples here of a communications toolkit, of a toolkit that's specifically about looking at addressing the policy around which many of these activities happen in countries, and it's much more effective if we can have policy that supports this kind of work. And then there's a toolkit about theory of change, which is a means of organizing development of services in a way that you can then make sure you take all the factors into account and measure whether it's had an impact further down the line. So these resources have been really downloaded a lot of times, and I think found very useful by lots of people who are part of the network. One of the other really key parts of this is recognizing that many people work in very dispersed parts of the world. Many people doing this work are often what's called at the end of the road, and actually have been working in isolation often for many years. And the MHIN website and the events that we put on have been a means of bringing those people together, encouraging people, allowing them to share ideas, allowing them to gain access to information that they probably hadn't had before, with the risk of people having to reinvent the wheel. So that community has been really important, and there's a number of means through which we bring people together through different forums, special events, the regular blogs, newsletters, that kind of thing. So this is one of the ways that we are sharing information. What we're doing right now is to have online webinar type forums, and some of the resources that have been developed for previous face-to-face events are on the screen in front of you. I hope you can see them. And there have been a number of really key global events, and in one case a British government event, where the professionalism of MHIN in drawing together this experience of our global partners has been really important in having a significant effect on people who make big decisions. So that's where we come to now. There are these networks that have been growing up globally, and for a while now we've been hearing the voice of people who are in one particular continent, let's say Latin America, saying, we think it would be really helpful to have more opportunities to talk to our colleagues in Spanish. And we've held a webinar in Spanish, and it turned out to be the most popular webinar we've ever held. We also did a survey of our members, and one of the questions was about whether people thought it would be helpful to have regional networks. And many people did say it would be very helpful to have regional networks. And we've been finding ways of making that practical on the website, and MHIN Africa is really the first example of the sister regional network, which will be which we're launching today, and I hope will be a means of people within Africa having more relevant information and conversations about their own particular needs, but very importantly, still being plugged in to the global MHIN network, and being able to have an African voice at that global level, but also having a more of a local profile. So that's what I wanted to say. I'm going to hand over to Crick now, and leave this page of advertising. I hope people will want to join the community during the course of this webinar and afterwards. Fami, if you can hear me, I think you need to switch over to Crick managing the hosting now. Thank you.
Okay, thank you very much indeed, Julian. So I hope that's given everyone online a sense of the Mental Health Innovation Network and some of the background to that, as well as many of the wonderful resources that MHIN has been involved in developing over recent years. So I'll now move on, if I can just share my screen, to give you a bit of a background and an overview of the MHIN Africa sister network, as Julian put it, in a moment. I'm just waiting for my screen to be shared. Seems to be a bit slow to be getting up. I've got the presentation already. Julian, do you perhaps need to switch your screen off in order for me to share mine?
No, I've done so actually. I think it's on you now, so you should be able to share it. The hosting is on you now.
So can you now see my screen with the Mental Health Innovation Network Africa?
I'm afraid I can't. But it does say that you're hosting now, so.
Okay. All right. Okay. I think I'm on now. Right. Can you now see my presentation, Mental Health Innovation Network Africa? Julian?
I'm afraid I can't.
Fami, are you on the line? Can you see it?
Crick, it's Agnes here. I can't see it either. I'm just trying to look up what we can do to sort that out.
Okay.
Okay, it's Asana now speaking. Julian, can you please put 6 slides up and share from your side?
I could do
It
that,
looks
yeah.
like I'm on a speaker now. Okay. Julian, could you let me know if you can see my screen now?
I'm afraid I can't. I'm not sure. You've definitely pressed the share
You
screen.
can click on share, which is on the top left part of the screen, and click share my screen. Yeah, that's it.
Now, yeah, brilliant. Yeah.
Thank you, Tommy. All right, so thank you very much, Julian. I'm just going to move this to full screen presentation. So just to confirm, can you see a slide that says Mental Health Innovation Network Africa at the top?
Yes.
All right, good. So I'll carry on now, and if I can just request, if you're not speaking, if you could please mute your line. So my job now is really just to give you an overview of the sister network, as Julian mentioned, of MHIN Africa, and I'm going to go through these points. What is MHIN Africa? The purpose of MHIN Africa, our history so far, and current launch activities, as well as structure and membership, to give you an idea of how you could get involved if you're interested. So what is MHIN Africa? Well, it really falls under the umbrella of MHIN Global, and I think the conversation around the possibility of starting up a regional network for Africa began at a Grand Challenges Canada meeting in Toronto in June 2015, and was then taken forward, I think, with further discussions at a meeting in Washington, D.C. In April this year. So there's growing momentum, there's growing interest from a number of different innovators working in the mental health field in Africa around getting this going. It really is an Africa-specific online platform for African mental health innovators. So this includes researchers, practitioners, policymakers, service user advocates, and donors working in Africa. Our main aim is to provide support for African mental health innovators to synthesize knowledge, disseminate evidence generated by research and innovation initiatives in the field of mental health, and also to then promote the uptake of this evidence in policy and practice. Our purpose is also to strengthen the network of mental health innovators working in Africa, to produce a newsletter which users can sign up for, and to create a forum where users can post discussions, can interact, can share events that are happening in Africa, share opportunities for scholarships, job postings or bursaries, and really to allow users working in Africa to have free control over these tools and really create a platform for strengthening mental health innovation on the African continent. The history so far, as I mentioned, at initial Grand Challenges Canada meeting in June 2015, the idea was initiated, and then in April this year we had a further meeting in Washington, D.C. to invite those interested to become part of a steering committee. And in June this year, the strategic plan for MHIN Africa was approved by the steering committee. And really this webinar is our first official launch. And we are now moving to extending our presence in the various regions across the continent after an official public launch, which will happen on the 22nd of November by Professor Oye Goreje from Nigeria. So our current launch activities are the online webinar today. We will have a stand at the World Psychiatric Association International Congress, which will be happening in Cape Town from the 18th to the 22nd of November. And then at the Alan Fisher Memorial Lecture on the 22nd of November, Professor Oye Goreje, as I mentioned, from Nigeria, will be officially launching MHIN Africa. So to give you a bit of an idea about the structure and membership, we have a steering committee which comprises representatives from each of the main regions, from West Africa, from East Africa, and from Southern Africa, as well as MHIN Senior Advisor, Dr. Julian Eaton from MHIN Global in London. And so far we've had quite a lot of interest from people across the continent interested in joining, and we've started to compile a membership list. We've gone to some trouble to make sure that we include both Lusophone and Francophone speaking countries, which I think is very, very important. And we're continuing to reach out to all the groups who are interested in being involved. We've also spent quite a bit of time thinking about leadership and the importance of accountability and ensuring that we have representation from all the regions. So far, we have funding from the National Institute of Mental Health through an affirm administrative supplement grant, and that's enabled us to provide salary support for a knowledge exchange officer here at the University of Cape Town, and we are looking for other sources of funding to really grow this network. So let's continue the conversation. You can see here on the screen some of the key websites, as well as Twitter and Facebook platforms, as well as an email address. So please be in contact. Let us know if you're interested in being part of this and how you would like to be involved. And this is really an opportunity to open the doors and to welcome exchange and contributions on this very exciting work. So that's the end of my presentation. I'd now like to move on to the next presenter, who is Dr. Dixon Chibanda, and I'll be moving on to sharing here Dixon's presentation. And Dixon, just wanted to check, are you online?
Yes, can you hear me?
Okay, yes, we can hear you. So would you like to continue, and should I just advance the slides from here, or do you have a presentation on your side that you would like to share?
I'd like to try and use my slides, if you don't mind. Let me see if it works.
That's great.
So I've just gone on to, just not sure how to do this. How do I share?
Okay, I need to stop sharing, so I'm clicking stop sharing here on my screen.
Okay,
so I think
now
you
I share my screen.
Exactly, yep, and you've got it. So at the moment we have, yeah, that looks like your screen.
So I'm trying to, I don't see it.
We've got your screen, we've got Dixon Chibanda on the top right-hand corner, so it looks like your laptop. It's got a World Health Organization homepage, and now that looks like your desktop.
Yeah.
So if you can get up your PowerPoint.
You're sharing, that's right, Dixon, it's working.
Can you see the title?
Yep.
We can see MHIN Africa working together, Dixon Chibanda.
Great, great. All right. So I'll start. I think this is really an amazing opportunity for researchers in Africa, you know, because it's really coming at a time when the evidence is growing from all parts of Africa. And, you know, this is really the best time to put together a platform that brings the different researchers or innovators from Africa, you know, to try and come up with a common sort of purpose. So, you know, one of the reasons why, you know, we need to really work together is because, you know, the treatment gap for mental, neurological, and substance use disorders is similar across Africa. You know, the challenges that we face, you know, are very similar. And also, you know, the interventions that have been developed in one country can be adapted for other countries. If you look at the evidence that is currently emerging from the different innovators. And I think one of the key issues as well is, you know, the use of technology just across Africa.
Dixon, sorry to interrupt you. I'm just going to ask if everyone who's on the line can please mute your lines if you're not speaking. We're getting some noise off Guy Yeoman's line. If you could just mute your line, it really might help with the clarity of Dixon's talking. Thanks, Dixon. Carry on.
Yeah, so I think, you know, the Mental Health Innovation Network gives us an opportunity to bring all these different issues, you know, positive things that are happening in Africa, and to really place them under one common sort of platform to empower the community of researchers and innovators. But I'd just like to use our example, the Friendship Bench, and how, we've kind of managed to do certain things that we would, be ideal to share through this platform. What is it that has, contributed to bringing us together that I would, like to share with people out there through this platform? So firstly, it's the whole aspect of community engagement. I really feel strongly that through this platform, we can share our knowledge from wherever we're working and how we have enabled this to happen. What are the key ingredients to come up with a successful community engagement plan? How do you get buy-in from key stakeholders? And how do you, develop an evidence-based intervention that then goes to scale? And how do you bring in that south-to-south collaboration and also the use of technological platforms? So just briefly, since, I really only have about 10 minutes as I was told, community engagement, with the Friendship Bench, we've realized that this is one of the most important resources, the community that we have. And right from the beginning, we've kind of emphasized the involvement of the community. There are lots of lessons that we've learned over the years, which we would be very happy